नमस्कार आणि येवकार तुमकां आयच्या ह्या खाशेल्या कार्यक्रमान आणि खाशेल्या दिसात नॅशनल डॉक्टर्स डे हो दीस आणि ह्या दिसाच्या निमतान आमी ऑब्वियसली मातशे स्टेटी भायर वता मातशे आमचे पेरिफरल राज्य वता आणि म्हाका दिसता फाटले 1-1.5 वर्सां आमी फिजिकली ट्रॅव्हल करपाक पावोंक ना थंयसर बट आमचो म्हाका दिसता सगळ्यांचो थंय मोग आसा आणि मागीर लग्नाची खरेदी जावं किंवा आनी कसलो विशय जावं किंवा मे बी अ लॉंग रायड ऑर लॉंग ड्रायव्ह म्हणा प्रत्येक गोष्टीक आमी बेळगावी हांगा आवर्जून वता आणि आयज आमच्या बरोबर जुळटा ते माझे दोन स्पेशल गेस्ट आसा इट्स ऑल इन द फॅमिली आणि नॅशनल डॉक्टर्स डे दिसा दोन दोतोर जॉइन जाता एक इज डॉक्टर उमेश वेर्णेकर जे गायनेकोलॉजिस्ट आसा आणि इनफर्टिलिटी स्पेशलिस्ट अगेन वर्किंग इन वेर्णेकर फर्टिलिटी सेंटर बेलगावी आणि दुसरे अगेन आय सेड इट इज इन द फॅमिली तांची सून जॉइन जाता आमकां डॉक्टर सौम्या वेर्णेकर जी पिडियाट्रिक्स आसा आणि वर्किंग इन ऑब्वियसली ॲट वेर्णेकर फर्टिलिटी सेंटर अँड ऑल्सो ॲट KLE जेका वेगळी ओळख करून दिवपाची गरज ना बोथ ऑफ यू वेलकम टू द शो दोतोर उमेश हांव तुमच्या कडच्यान सुरवात करता म्हाका एक सांगा की आयज हो नॅशनल डॉक्टर्स डे सध्याच्या परिस्थितीन डॉक्टर्स हॅव बीन द सुपर हिरोज ऑर द सुपर वॉरियर्स दॅट यू नो सगळ्यांनी आमी पळयला तुमकां ह्या दिसा तुमचे विचार कितें मांडचे दिसता
Thank you very much, Rohit. We have program आपलो. ती प्रश्न जो विचारला हे डॉक्टर्स डे सेलिब्रेशन हे जे सेलिब्रेशन करतात की टू गिव्ह टू द मार्क टू द डॉक्टर्स डिग्निटी and the respect on the mark of respect. And we celebrate it in every institute, every college, every hospital, and we call the doctors and we give them mark the respect into and we arrange the programs to the doctor. Therefore, this is a very important as a doctor is concerned. Actually, this is की डॉक्टर लोक हा दिवस खूप महत्त्वाचा असतात आणि व्हेरी इम्पॉर्टंट.
Okay. I'll just take opening comments from Dr. Sowmya also. Dr. Sowmya, म्हाका तुमकां आवर्जून विचारूंक जाय की यू ऑब्वियसली प्रॅक्टीस ॲट द फर्टिलिटी सेंटर हियर ऑल्सो तुमी शिकयता ॲट द KLE अ प्रिमियम इन्स्टिट्यूट वेर अगेन इट डजंट रिक्वायर एनी इंट्रोडक्शन म्हाका खूब खूब जाण विचारता की हे नवे डॉक्टर्स जे शिकपाक आयला शिकता किंवा जस्ट मे बी आउट ऑफ देअर एड्युकेशन हो फाटलो वर्स ते 1.5 वर्स हॅज बीन अ पावरफूल चॅलेंज टू दॅम आणि म्हाका दिसता गोंय आणि बेळगावी किंवा बाकीचे राज्य आमी पळयता इज नो डिफरन्स सगळ्यांनी आमी पयली वेव पयली सेकंड वेव पयली अशा विथ रिस्पेक्ट टू द न्यू स्टुडंट्स दॅट आर कमिंग आउट न्यू डॉक्टर्स तुमकां कितें शेअर करीन दिसता ऑन दिस पर्टिक्युलर स्पेशल डे
The pandemic, if you have to say, it was unexpected. Even we had not prepared for this. Suddenly, when the pandemic came, we started gearing up. Initially, when the first lockdown was introduced, we were totally clueless as to what will happen. But then we got our PPE kits, got our N95 mask. We started preparing and we gave awareness to the public regarding what are the COVID appropriate behavior. Wear mask, sanitize, wash your hands. And now what I would like to say is for the general public, please follow the COVID appropriate behavior. Use your mask appropriately so that it covers your whole of your nose and mouth. And next thing, hand sanitization. The next important thing is you have to maintain your hand sanitization and then the social distancing. That is my main appeal for coming here. You follow the COVID appropriate behavior and that time the major load on the doctor community will come down. We cannot blame doctors. We are not doing, but you also cooperate with us and that is how we can calm down on the pandemic.
ओके ग्रेट डॉक्टर उमेश म्हाका एक विचारपाक जाय इज यू आर यू आर अ गायनेकोलॉजिस्ट बेसिकली आणि तुम्ही ऑब्वियसली काम करता इनफर्टिलिटी वीच इज अगेन अ चॅलेंज फाटले 1-1.5 वर्स बऱ्याचशा गोष्टी पीपल हॅड केप्ट ऑन होल्ड वेदर इट इज नाव फॅमिली प्लॅनिंग आणि वेन इट कम्स टू इनफर्टिलिटी दॅर इज अनदर चॅलेंज दॅट यू हॅव टू टेक केअर ऑफ तुमचो एक्सपिरियन्स फाटले 1.5 वर्स बेळगावीन जेन्ना तुम्ही ऑपरेट करता तुमचो एक्सपिरियन्स कसो आसलो
During COVID time, people found out that patients, they are more worried beginning the 3 to 6 months. And there was panic. As infertility is concerned, as a pregnancy is concerned, the treatment part goes same to all the patients. And the pregnancy rate also came down during the pandemic of COVID. And as infertility is concerned, as a Federation of Obstetrics and Gynecology, they told you can stop all the procedures because all the tested baby, IVF, and donor insemination, all the programs have been abandoned for 6 months
Hmm.
because we are worried of infection.
Hmm.
Number two, the pregnancy and the COVID is concerned, we have made COVID
Hmm.
different center. There we started delivering patients there. मतलब
Hmm.
delivery आम्ही थंय करू लागले.
Hi.
And the normal patient we started in normal the hospitals.
Hmm.
And before coming for delivery and other things, we started doing the COVID test. But आम्ही COVID test करू लागले.
Hi.
If the COVID test is positive, we used to do in the COVID hospital.
Hmm.
And if the COVID test is negative, we used to do in the normal hospital.
Okay.
In that time, even the delivery rate and the pregnancy rate has come down.
Hmm.
Number two, my son is also a gynecologist.
Hmm.
And in the beginning, it is very difficult to treat the patients as well as to do the cesarean section and the normal delivery was difficult.
Hmm.
By taking precaution, my son, Dr. Nikhil, he was working in BIMS Medical College.
Hmm.
He has operated several COVID patients as well delivery he has done, and the patient post-operatively also comfortable. Therefore, treatment part as well as the management part remains the same. But these pregnant ladies are more morbid, but they will be a little bit risky, little bit high side.
Hmm.
Yes.
ओके ऑल्सो तुमकां एक विचारीत की हॅव थिंग्स गॉन बॅक टू नॉर्मल आता हॅज वर्ल्ड एस्पेशली वेन यू आर प्लॅनिंग फॉर अ बेबी हॅज थिंग्स गॉन बॅक टू नॉर्मल
Yeah, as such, gynecologist, there is no contraindication for going for pregnancy. Even they can go for pregnancy. Most important is they have to take the precaution of COVID. Whatever the government or whatever our federation or whatever the declares, we have to follow the stricter rule. Automatically, we can prevent the COVID and you can go for pregnancy or delivery, and there's not much more mortality rate. Only 1 to 2% mortality rate, and there's no to panic. As the public is concerned, there's not to panic in this situation. Number two, government is also announced. Government are announced they can take the vaccine also.
Yeah, the pregnant ladies can take the vaccines now.
Yeah, they
Correct.
can take the vaccine. Recently, the protocol has come. They can take. There is no side effect at
Correct.
all.
Correct.
No side effect. They can take this.
Okay, Dr. Sowmya, I want to ask you is once the baby is born, tajanantar is very challenging because the baby is small, you know, it's an infant initially, and tajanantar obviously magi taje take care karpa every time you have to visit a doctor or a hospital. You know how things have changed for parents, newborn babies je asa tanchi काळजी घेवपाक, you know how things have changed and how are you coping up when you are interacting with your patients.
Yeah, things have definitely changed from the, we can say it as an era of pre-COVID and post-COVID. Now we have started to live with COVID. So the question is whether COVID is going to, when is this going to end? The question is, we are going to live with it. The pandemic is going to change to endemic. Just like the way malaria, dengue, which we are living it, the COVID, we are going to live with COVID in another few days. Coming to the child, once he is born, we'll be giving BCG and hepatitis B and OPV right at birth. And the routine vaccination will follow, like 1.5, 2.5, 3.5 months. The child has to take his routine vaccination, and there is no excuse for it. Now the question arises, what if the parents are positive, or what if the child is turned to be positive?
Correct.
If the child is positive, proven to be positive, then you delay it for 2 weeks. Once the child is asymptomatic, again you can give the vaccination. But that is not a reason to stop the vaccination. You have to continue with the childhood vaccination, whatever is there. And the question arises, what if the mother is positive and baby is negative? If the mother is positive and baby is negative, the mother can still take care of the baby, provided she uses the appropriate mask, sanitizes her hand. That is not a reason to separate the baby from the mother. Another scenario wherein both are positive, yes, again the mother can take care of the baby. If the baby is positive and mother is negative, should the mother go to the baby? Of course. the mother has to take care of the baby, provided she uses all the appropriate behavior. There is nowhere said that the baby has to be isolated from the mother. The baby always gets the care from the mother. Use the COVID appropriate behavior. Again, I stress on the same point, using the COVID appropriate behavior. Mother should be taking care of the child. And breastfeeding has to be continued. And the best immunity what a mother can give to the child is breast milk. At least completed of 6 months, she has to exclusively breastfeed the child and continue breastfeeding for at least 2 years. And that's the best and the most precious gift what a mother can give to the child.
Okay, Dr. Umesh, in regards to infertility, I just want to understand is obviously the challenges to be mentioned kele, but as technology is progressing, there are a lot of parents. Everybody wants a child once they are married, and when you have problems like this, they turn up to you for advice. Maka sanga, in terms of technological advance, a lot of upgradation has happened. If you can update on the profession that you are, especially in terms of fertility.
Yeah, Rohit, this is a very good question. Now the infertility is concerned, it is all about that. The most important part is obesity. Obesity part, there the most patients they are coming to us, unfertility patients they are PCOD, polycystic ovarian disease. So because of that, every girl they should take care of their weight, their exercise, and maintain the BMI, basal metabolic index, they maintain to that. If the basal metabolic index and obesity, everything is under control, the pregnancy rate will be very high. This is one factor. Number two factor, as a male, as a male to consult as a single kid problem comes there. Nowadays, their sperm count is coming very low. We see 10 patients, out of the 10 patients, 3 to 4 patients, their count is very low. Therefore, this is also very challenging to the gynecologists now, and they are taking maximum care to bring down increase the sperm count. And previously, the sperm count was there, like 30, 40 years, so sperm count was there, 50 million, 100 million. But now you see, out of 10 patients, all 6 patients, if you see, they are 10 million and 20 million, and it's becoming a big challenge to the gynecologist. And number 3 is the concern with the people, they are IT sector or they are late marriages, and these are also creating so many problems. We have seen the patients in Bangalore and Pune, the people, they are so busy, they don't have no time for the go for consumption. There they come to us and complain about the pregnancy problem. Then they go for natural, that is called a laboratory child. They want to go for test tube baby, they want to go for ICSI, or they want to settle the sperm and they want to go for the other procedure and they want the child. And this is becoming big challenge to the family also and the couple also. Therefore, I request to the people that they should go as early as possible for the child. And दूसरी modality comes as the single they will go for more anomaly babies. That is also very important. That also keep in mind. Now, as far as what you asked the question, as the development in the infertility is concerned, we are doing in our hospital like a test tube baby, as a test tube baby, and number 2 ICSI, intracytoplasmic sperm injection. And my son is also more expert in doing laparoscopic surgery. We do laparoscopic surgery to recanalization of the tubes. Like that, so much advance is going on in infertility, and we can do the best result for the infertile couple. We can do the best result for the infertile couple. Yes.
Dr. Sowmya, my important question is, fatle kahi mahine there was a lot of apprehensions that this third wave is happening. It is happening or no? We will come to know maybe in due course of time. But again, susceptible population was the newborn, because that is one population that it had not been affected. I mean, gradual pehle ki it was 60, 50 plus. Then the mid-age group was affected. Now people think we don't know what will happen. So what is your take, one, in terms of this third wave, who will it affect? Just maybe your thought process, one. And secondly, how does a parent take care of, first of all, themselves and also their newborn babies or even the child that they have?
Okay. It's a good question whether third wave is going to happen or not. According to the virologist like Jacob Johnson. He's a famous virologist. According to his wave, as I already told you, let's not panic about the third wave and it's affecting the people. There is no scientific basis to say that the third wave is going to happen and it's especially going to affect the children. And let me tell you, according to the statistics, in case of children also, 70 to 80% are asymptomatic, even if they're RT-PCR positive. That is, even if they're COVID positive, 80% of the children are asymptomatic, like they don't have any symptoms. And 10 to 20% have some mild symptoms like cough, cold, a fever or something. 1 to 2% of them end up with severe disease. And who are these 1 to 2%? Who are already having a pre-existing disease, be it a heart ailment or some already a chronic liver disease, any pre-existing disease like a cancer, who is already taking chemotherapy for other reasons. They are the children who are affected. Keeping this 1 to 2% in mind, I don't think the whole population should be panicked. Okay, so that is not a reason to panic. It's been a year and a half. Now we have to learn to live with it. If you have seen the countries like Singapore, where they have learned to live, they say that, use COVID appropriate behavior, you're not going, and it's going to live with us. Okay, so it's like, I don't think it's a time to panic, but definitely we have to prepare ourselves as medical fraternity. We have taken care of all the equipments. We don't want what happened in the second wave, we have kept all our medicines or oxygens, everything ready. We have been prepared for the third wave. But my request to people is to not panic. You follow your duties, that is, use your mask properly, and please avoid social gatherings. I think that is the root cause. As much as possible, maintain social distancing. That is my appeal to the people.
Okay, one straight question upfront is, a lot of people want to travel to Belgavi for n number of reasons. Now, what is your advice to the Goans watching here in Goa? What would you like to say? This advice come from Belgavi directly?
Get your RT-PCR. If it's negative, then okay, you can safe to travel. Once you're here, I think it should come in apostrophes. Please, 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 wherever you go, whether you're at home, whether you're in marketplace, any place, again and again, I'm going to stress on the only one point: COVID appropriate behavior. It stands for only 3 points. That is, use your mask properly, sanitize your hands, hand hygiene is very important, social distancing. Let me tell you one more thing. I'd not put it as social distancing. I'd put it as physical distancing with social connections.
Correct. Very
because
true.
of this social distancing, people have lost the bond. Please, I think we should change the terminology from social distancing to physical distancing with social connections to be kept.
Okay.
Let there be connectivity.
On that point, I want to go to.
Come in tougher
Very true. On that point, I want to go to Dr. Umesh, because Umesh Bab, you have Goan connection. Just like your daughter-in-law has said, socially you have to be connected to your roots. Now, because of this pandemic, a lot of people are not able to travel to their hometowns or maybe go visit for some XYZ reason. तुम्ही हे जग बदलताना कशा पळयता आणि obviously as we run up towards third wave, your daughter-in-law has nicely explained. But as we run up also towards the completion of vaccination, जे सरकार म्हणता डिसेंबर मेरेन आमकां करपाक जाय, whether it is realistic, non-realistic, let us not talk about it. But as we progress day by day, how things should be?
Yes, Rohit, this is a wonderful question. Going to Belgavi, they like it. Every Sunday they come to Belgavi. As a COVID is concerned, they should take maximum precaution. Whatever my daughter-in-law has told, this is a request to the people of Goa. The one thing is, whatever she told, you make social distancing, not traveling to any group meetings. Third is to wash your hands regularly. And last one is best is go for vaccination. If you take the vaccination, there are a lot of the problems going on taking the vaccination. I advise all the grown people that vaccination is one of the best things they can go. Take both the vaccination. Why I'm telling you that vaccination is very important. Don't miss the vaccination. Why? We have done the research work. Out of 100 patients admitted into the Apollo hospital, they have noticed that out of 100 patients, COVID vaccine patients, and 100 patients with COVID disease without vaccination. Out of 100 patients, COVID, 5 to 10% of the people, they go to the ICU. Whereas COVID vaccine is taken patient out of 100, not a single patient is gone to the equal patient to ICU with a galna. And number two, the mortality rate is very low. The mortality with the death rate is very low. Therefore, I request to the young people that each and everybody, please go for vaccination. Vaccination kar gaya. My humble request. I'm praying to you, don't hesitate to go, and there is no complication at all. There is no report of any the side effect of the vaccination. This is my humble request to go, people. Once you take the vaccine, and you will be enjoy. You can come to Belgavi at any time. And once your COVID percentage comes to 2% or 1%, I think so. Government is allowed to come to Belgavi or go to Goa. There's all my entire Vernekar family is Goa only. I also welcome them to Goa, Belgavi. So I request, my final request to the people is, please go for vaccination. Vaccination is the line of treatment. Once the vaccination program finishes, entirely COVID will be disappear from this world. That is my humble request. Yeah.
ओके गोवा कनेक्टाच्या माध्यमांतल्यान आमचे म्हाका दिसता एक विशय आसा टू कनेक्ट पीपल टू बॅक टू देयर रूट्स आय थिंक दोतोर उमेश वेर्णेकर इज वन सच एग्जाम्पल हू वेंट टू बेलगावी सेटल्ड देयर एंड रन्स हिज एंटरप्राइज बट ह्या माध्यमांतल्यान ह्या कार्यक्रमाच्या माध्यमांतल्यान आमकां एका गोंयकारा कडेन उलोवपाक मेळ्ळें ते सुद्दां कोंकणीन तांच्या सुने कडेन उलोवपाक मेळ्ळें ते सुद्दां मातशें कोंकणीन सो इट वॉज नायस टू हॅव बोथ ऑफ यू दोतोर उमेश एज वेल एज डॉक्टर सौम्या फॉर जॉयनिंग अस एंड शेअरिंग दिस व्हॅल्युएबल इन्फॉर्मेशन ऑब्वियसली विथ रिस्पेक्ट टू बेलगावी एंड ऑब्वियसली गोवा एक इम्पॉर्टंट गजाल म्हाका बरी दिसली जी दोतोर उमेश वेर्णेकराच्या सुनेन म्हटलें की आमच्या मदीं सोशल डिस्टन्सींग आसपाक जाय डिस्टन्स आसपाक जाय पण मनीसपणान खंयच डिस्टन्स आसपाक जायना मनीसपण मातशें उरपाक जाय फाटले 1-1.5 वर्सान आमी खूब पळयले खूब त्रास काडले बट आय थिंक ह्या फाटल्या 1.5 वर्सान आमकां खूब शिकयलें सुद्दां आनी ह्या शिक्षणांतल्यान आमी खंय तरी बोध घेवपाक जाय आनी फुडें आमचो फुडार डिसायड करपाक जाय नॅशनल डॉक्टर्स डेच्या निमतान आमी कनेक्ट जाल्ले तांच्या कडेन वेल अशें आनी वेगवेगळी कार्यावळ आमी तुमच्या मुखार घेवन येतले तोपर्यंत पळयत रावात प्रुडंट.